Welcome to Geological's mini-series dedicated to sports and orthopedic acupuncture. For the next few days, I'll be bringing you several podcasts a day from the Sports Acupuncture Alliance's conference in San Jose, California. In addition to interviews and discussions with speakers of the conference, you'll also be hearing from participants, and you'll have a special front row seat at a roundtable conversation around the issues of running a sports medicine practice. The Sports Acupuncture Alliance was created to promote the study and practice of sports and orthopedic acupuncture. I'm delighted that they were willing to partner with Geological to bring you this mini-series so that those of you who were not able to attend the conference could learn from the speakers as well as the participants and to get a taste of what it's like to be here at this special event. Please enjoy these discussions and take what you learn here and use it in your clinic. These conversations come to you through the generous support of our sponsors and members. All the sponsors here provide helpful products or services that you'll find beneficial in your clinical work. Want to get better at treating concussions and other neurological conditions? Clayton Shoe has some innovative methods. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. Later in the show, Jane offers you helpful suggestions on how to raise your rates, and Golden Flower Chinese Herbs shares a journey of healing that I think you'll recognize. Do be sure to visit the sponsors page on the Geological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more. Ever found yourself listening to a geological conversation and thinking, wow, I needed to hear that? Yeah, me too. And I never know when I'm going to hear a guest say something that stops my world and reboots it with a larger perspective. If these conversations have ever helped you to feel more grounded, more inspired, or just less alone in this strange and wonderful work we do, consider becoming a member or supporting the podcast with a bit of tithing to the donation jar. It helps keep the lights on here at the Geological Sound and Motion Lab so that we can bring you these conversations every Tuesday morning. You'll find all the details at geological.com. Thanks for listening and for being a part of this.
Hey there, I'm Cameron Jafari, an acupuncturist from Los Angeles. So I started learning nanopuncture from Dr. Clayton Shoe because I was facing these complex neurological conditions like stroke and MS in my clinic, and I just felt like I lacked a solid process to treat them. Brain-related issues always felt like a whole different animal, and I was looking for a clinical system that worked and could guide me through them. So after attending my first nanopuncture seminar, I was able to apply the process pretty quickly and with pretty amazing results. I remember the first stroke patient I saw afterwards was a guy who had a stroke 2 years back, and he couldn't talk at all. And after a few treatments, he started saying a few words. And a few treatments after that, he could actually have conversations. It was pretty incredible. So this is why I feel like nanopuncture is the future of acupuncture neurology. And you can be a part of that. Their next seminar is on treating concussions and is being co-taught by both Dr. Shu and Dr. Ayla Wolf in New York City on April 26th and 27th. To learn more, visit nanopunctureseminars.com.
Hi, I'm here with Whitfield Reaves, who's one of the speakers here at the Sports Acupuncture Alliance's conference. Hey, Whit, you've been doing acupuncture since 1981. That is a long time. I'm curious, what are some of the changes and some of the trends that you're seeing with sports acupuncture these days?
Well, I would say the biggest thing that comes to mind is that the patient is very different in this era than the patient was in 1981. In 1981, the patient presented signs and symptoms very differently, and the evolution of the disease and the pathophysiology was very different even just 30 years ago, very much so. And
What were you seeing back then that's different than today?
well, nobody had a computer. So there was no keyboarding. There were no
Uh-huh.
devices. People weren't on electronics, and so number one, we did not have the postural component of the rhomboid minors engaging to retract the scapula, pull the scapula back, and we didn't have problems with the forward head looking down at devices. So that's one huge piece. And people didn't sit as long and often in desks. A lot of people had real jobs and worked and did things. Now
So they
people
moved more. There was a whole different movement diet.
absolutely. And I just read an article 3 days ago about it was JAMA or one of the major journals that was looking at exercise, and they actually concluded that it didn't matter if you moved a little bit or if you did intense cardio, sweating, burning, if you ran a marathon or if you walked down to the store. The difference in health by the various ways they were measuring it was not that great. And so back then, people were moving much more, and a desk job where you just sat all day long was much less common. And so the gluteus medius is what comes to mind of a muscle that gets turned off in the seated position. And so now we've got all these back problems, all of these degenerative disc disease, all these bulging discs and deterioration of the lower lumbar spine. And you just didn't see that in 1981 like that. You saw people who were shoveling, and lifting, and they strained their back from lifting and twisting, but not from slightly moving. That was the straw that broke the camel's back from someone who's been sitting at a desk job for 10 years, programming a computer with their head forward. And that's a huge, huge difference.
So it sounds like what's happening is people are moving less. We have very different physiologies, and we're in many ways much weaker than we were back in the 80s. Do I have that right? Is that what's going on?
I would say you have that partially right. We are weaker in certain very key places, like the muscles that retract the shoulders, pull the shoulders back, the muscles that pull the head back, the muscles that stabilize the pelvis that get inactivated by sitting. But in other areas that were hugely stronger, as many people work out and train, and CrossFit is an example. So it isn't quite so, it's not like we're weaker, but we're weaker in very key postural areas. And if someone doesn't work on that, if they're not in Pilates or in yoga or some sort of discipline where that gets addressed, it becomes problematic, hugely problematic.
So the injuries are different these days.
Yes and no. There is, for instance, in 1981, I did not know how to treat the rhomboid minor or the gluteus medius to activate and stabilize the shoulder, neck and shoulder, or the lumbar spine. I just didn't know how to do it. And I didn't think about doing it because it didn't seem like that was what was presenting, but I well could have not been educated enough at that time, learned enough to know that.
Well, there certainly is that. We learn as we go.
Yeah. So, but the other thing, and I think this is also very important, is that the prolonged exposure to what I would call artificial environment. I mean, in a sense, I'm really a Taoist, and I love being in nature. And I love, like, being in California. I go to the sequoias and I just lay on the ground next to one of those massive trees, and the energy is just incredible. And so I love nature, and I see that in the Taoist tradition how important the union of heaven and earth is the human. And as we don't have enough earth because we're sitting in chairs in offices with artificial climate control and fluorescent lights and the sort, we get imbalanced. And I think that what happens is the neurologic system starts overreacting to, to any stimulus. You can see the overreaction just in the personality of people who have gotten shorter and agitated and angry, and relationships where one of the two spouses is overreacting to the other spouse. And so you can see this kind of behavior in this combativeness. And on a physiological level, we're talking about neurologic overbearing or over reaction to stimulus. So somebody gets a strain of as in tennis elbow. And in 1981, tennis elbow, 3 treatments, and the patient was fixed. Now you get a tennis elbow patient on a computer programmer, and you don't know if it's going to take 6 months to get this person fixed. And so the neurologic system, I think, has reacted and has overreacted and created pockets of stagnation all over the body, wherever things are not right posturally or from injury, trauma, repetitive stress, and the sort. And so you get pockets of chi and blood stagnation, which then gets to your original question, what's different? And what's different is in 1981, Master Tong and the empirical points of Chinese medicine, of Chinese acupuncture, were marvelously effective. They were just brilliant. 1, 2 needle treatments and people get fixed. And every decade, it's gotten about 10% less effective. And so 10, 20 years into this, the many of these points, for me, and I'm only talking my experience, I don't know what somebody else does, but my experience is that those stagnations are so fixed that you can't go to a distal point and move the chi because there's no blood flow getting into that area where the pain and the stagnation and the injury has occurred. And so no chi, no blood, no blood, no chi.
I mean, it sounds like local treatment's really helpful. You get in there and bust that up. I'm really struck here what you're saying about this overreaction of the neurological system, because what it sparks in my mind is increasingly we see lots of autoimmune disease as well.
Exactly.
And that sounds like just the other side of an over-amped neurological system. The system's just sort of turning on itself. It does not know what to do with itself.
Absolutely. I think it's the same mechanism. And I know so little about internal medicine that I couldn't speak knowledgeably about that. But I think you've got it precisely articulated. Yes.
Well, so that leads me to this question. And knowing something about internal medicine or not, it sounds like you've got your eye on this. You're working with it. You see it's present. You're taking that into consideration in the work you do. So what are you doing to help dial down the nervous system so that people can have enough stillness to maybe move some chi and blood and have a little quiet time to actually heal?
Oh boy, you're asking the impossible. I mean, how do we ask our patients to live in a way that's different than the dictates of our current culture. It's very, very complicated. It's very, very difficult. And I have reached the place where I just don't feel like I can change that. The psyche, the communal psyche of this country, especially, is such that, I can't change that. I can't change the way people are reacting to the world because of these powerful forces of greed and consumption and the sort. So I just try to fix pain, and if the patient will listen to me, I'll try to get them to go on a vacation or maybe even meditate if they're open to this. But I don't have a solution for that. The ultimate problem that you're talking about, I don't know. So I just have to exist within the confines of what I'm given, and I do the best that I can. And it just isn't as easy as it was 30 years ago.
Right. So you don't add in some sort of spirit points or do something that tries to dial down the reactivity. You're working on the blood and chi of the presenting problem and letting that sort of reverberate through the system.
Pretty much, yeah. If I think that a patient really needs internal medicine, of course they all do, I refer them out. I'm not skilled enough to do a good job of point selection and, of course, herbal prescribing. So I'll refer that out. That's the best that I can do. But I do love the formula Jiaowei Xiaoyao-san. I mean, Jiaowei Xiaoyao-san to me is the formula of the era. It harmonizes the liver. It clears the heat in the liver. It nourishes some of the liver. It does a lot towards addressing this neurological stress sort of related reaction in the body. So of any one formula, that just stands out as just, a really great way to start with someone. But
yeah, we all have our favorites for those,
yeah.
don't we?
Oh yeah.
I'm kind of a Chaihu Shugan-san guy myself.
Well, both of those are so close, so similar.
They are.
Yeah,
they are.
And I do use that formula, by the way, often depending on the patient. So yes, that all fits into that category of harmonizing.
It's so reassuring and validating to hear what you say, that people are different today than they were back in the 80s. I mean, I remember before screens, right?
Oh, yeah.
And, we all had this little computer in our hand. And certainly I watch what it's done to people's attention. I watch what it does to their posture. I mean, you describe it really well with what it does to the rhomboids and neck postures and things like that. You've seen these incredible changes that it's like we're co-evolving with technology, and it's having a big impact on our physiology. So it leads me to wondering about what else about acupuncture, and maybe orthopedic in particular, because this is your sweet spot and the thing you love. What are some things about acupuncture that you now believe that you didn't believe 10 years ago?
Wow. Good question. Well, I get down to very simple things. And so my work is very simple. Anybody who's taken my acupuncture sports medicine apprenticeship program knows that I sift things down to very simple, easy to understand assessments and treatments. So what stands out to me is the power of the acupuncture needle, that when it is put in the right place, precisely to the millimeter in the right place, that whatever the barrier is to the flow of blood in this area of stagnation, that the well-placed needle is absolutely miraculous. So that generally speaking, treatments don't take 6 to 10 treatments cumulatively to fix something. It often takes one treatment, and that treatment might happen on the first day, or it might happen on the 10th day, depending upon your fortune and your karma and your skill and what it is you're doing. But the precision of all of it is what has kind of marked the last 10 years for me. And I was criticized in a doctoral program teaching that I was too Eurocentric. And I am a white guy, I'm really white, so I could understand some of my work may appear Eurocentric, but I spent a little bit of time saying, okay, I have to listen to this criticism or critique, and I have to really look at it. So I dug into a very simple text by Mao Xing Ni, Master Ni's son, his translation of the Huangdi Neiqing Su Wen. And I just started reading through stuff. And I always have this quote right in my hand. I have it in my hand right now. And this is one little section where Chi Po says, "What is meant by acupuncturing the bone level, but not injuring the tendons?" And the emperor responds, the physician responds, "When needling deeply, do not stop at the level of the tendons before reaching the bone level. Go all the way in one breath or a series of breaths, depending on your technique, but reach that depth without removing the needle. When needling to the depth of the tendons, one can avoid injuring the muscles by inserting past them. This logic follows with each specific level. The needle must go to the proper depth. Any depth other than the correct one will cause undesirable effects."
This episode is brought to you by Jane, the clinic management software that I use to keep my practice running smoothly. So, let's talk about something that can be a little bit uncomfortable: raising your fees. I know, this is something that might feel awkward, but it doesn't have to. With a bit of planning and care, you can handle it in a way that feels right for you and your patients. One tip: give yourself at least 2 months to prepare. This gives you time to get comfortable with the change and let your patients know what's happening. You can share the news through emails, booking reminders, or even just a friendly little sign in your clinic, and avoid over-apologizing. Instead, keep it straightforward and matter of fact. Keeping things consistent across the ways that you communicate can really help avoid confusion. Fee increases aren't always easy, but you're not on your own here. For more tips and ideas on how to communicate these changes with confidence, check out frontdesk.chain.app and look for the article, How to Tell Your Clients You're Raising Your Fees. Oh, and one last thing, if you're ready to give Jane a try, use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. This is the precision you're talking about.
This is the precision. Now, I have no idea what all of that meant above, of needling past the tendons and et cetera, et cetera. And it went on in ways that I couldn't understand it. But I did understand that each of these layers of anatomical tissue were being clearly described, and that the needle must go to the proper depth, and any other one than the correct will cause undesirable effects. That's what struck me. And I went, you know what? What we're doing is traditional Chinese medicine through and through, and Eurocentric or not, everything we're doing is backed up in the classics.
So how is it that you were accused of being Eurocentric?
Oh, so many people love when you have to feel the pulse, or you have to treat the Zhang Fu. You're not really going to the problem. People forget this simple fact. The cause of disease, it can be exogenous, wind, heat, cold, damp, etc. The causes of disease can be endogenous, the emotions, or the cause of disease is other. And in the other causes of disease are accident and trauma. And people are always trying to go to look at the Zhang Fu, the emotional state, trying to find this root, this Zhang Fu root for this disease, when the cause of disease is trauma. Treat the trauma.
Treat the trauma. Yeah. Or just one of the great things that Dr. Tan would always talk about is forget the Zhang Fu. What's the channel that's involved? What is the tissue that's involved?
Yeah.
And get that dialed in.
And I need to criticize that or critique that from the standpoint that was very effective 30 years ago. But if you get on the right channel, the right meridian, but the trauma or the stagnation is fibrotic and walled off from the rest of the body, you can activate that channel, but it's not going to get better if there's no blood flow and therefore no chi into that pocket of, say, if it's a tendinitis or a tendinosis with fibrosis, So that is what has changed so much of my thinking, that the meridians are no longer, for me, as functional as they used to be when I first got into practice. Just put in a couple of distal points and patients better. Now it's like, well, that's not working because there's fibrosis and stagnation that is so enclosed and no longer integrated into the system of the body, and that local area needs to be opened up.
That totally makes sense. I'm thinking about some cases in my own clinic, and I'm thinking, wow, yeah. And sometimes I can palpate, and you can feel this gooey stuff, or there's areas really striated, things like that. So what do you do? Is this a matter of distal and local, or are you using palpation? How do you suss out these pockets of stagnation and liberate them?
I love the language, suss them out and liberate them. I would say that in order to understand where that stagnation is, orthopedic testing is more reliable than any other way of assessment that I know in general. So, for instance, if you have a tendinitis or you have a nodule on a tendon and you've got pain, in the tendon and what have you. You can needle above and below on the meridian and nothing happens. And it's because of this fibrotic nodule. But in this particular case, actually, I'm talking in circles. But this particular case is very clear because you find the lesion, you palpate the lesion, and treatment is fairly simple. If above and below and distal aren't fixing that, then there's no blood. You have to needle locally. However, what about the things like a rotator cuff injury that refers pain out into the deltoid? You can needle the deltoid, Li15, Li14, Sanjiao 14, Sanjiao 13. You can needle the deltoid till the cows come home, and it's not going to fix the problem. The problem is back in the supraspinatus or the infraspinatus in the Tai-Yang area of the body. And so by orthopedic testing, you can determine that there's dysfunction in, say, the supraspinatus. That's just my favorite muscle, and that's what always comes up. There's dysfunction in the supraspinatus, and then you translate that into Jinglo. That's the Tai-Yang meridian, small intestine 12. And then you look for where those nodules or stagnations or trigger points or what have you are within the context of that muscle tendon unit. It could be tendon, it could be muscle, it could be muscle belly, it could be muscle tendon junction, but at least you know about where the stagnation is. So you're not wasting your time needling into tissue that's really actually not the problem.
Right. Like you said, you got to be precise.
And so The meridian idea works great when the pain is on the meridian and everything lays out perfectly. But when you have a referral pattern going from one area to a whole other area, the meridian becomes exceedingly ineffective. And I would say how I came about this was that in my early years, 81, 82, 83, of treating patients, I would needle bladder 23, bladder 25, bladder 40, bladder 60 to treat back pain, lumbar pain. And it wasn't very effective. As a matter of fact, it was really less than placebo, And little by little, as I came to understand things, meeting Janet Travell in 1983 certainly helped significantly, tune my attention to the muscles and trigger points and the anatomy and the function of those muscles. That you would then realize that much of back pain is due to the quadratus lumborum, which is almost on the side, and it's a Xiaoyang muscle. And so treating Tai Yang all day long. Back in the old days in China, the cold would just drain the kidneys of these individuals and they would have low back pain due to the kidney. But that's not what we see. We see other cause of disease, strain, lifting, twisting, strain, and it's not a kidney problem. And so treating the bladder and the kidney till the cows come home doesn't really do much in my experience. Now, maybe other people get great results with that, but I would say the number one reason why people come to my apprenticeship program is in about 3 or 4 or 5 years of practice, they come in and they say, I've been doing bladder 23, bladder 25, bladder 40, bladder 60. It's not working. And I need a different perspective because things aren't really clinically resolving as I thought they would. And I'm a really good student and I've studied hard and I'm doing everything that I was taught, but it's not working the way.
It's not doing what it's supposed to do. Yeah. There always comes that point where we've got these maps in our head, or these ideas, and they kind of work. But then at a certain point, it's like you have to throw the map away and start navigating with a compass.
Yeah, there you go. Yeah.
And it sounds like the compass that you use is various orthopedic testing and really paying attention to what is connected to what.
Yeah. Visual, postural assessment, palpation, literally palpating along a muscle, trying to find if there's a bursa that's inflamed, or rolling across a tendon to see if there's a tendon problem. But yeah, orthopedic testing, manual muscle testing, visual observation, and palpation with my hands to find out where the problem is.
Yeah, going to the source, using the body to assess the body.
Yeah. And I'll tell you, I learned something early on. I was very fortunate to learn this early on from a nurse practitioner that I worked with. And I was really struggling with a case. And she looked at me and she said, Whit, you're thinking that this patient has a really rare, strange, and peculiar disease. And you're trying to be the hero to figure out what the diagnosis is, and you're going to come up with something that none of the other specialists could come up with.
Yeah, dude, your house.
Yeah. But statistics would say that in 80 to 90% of the time, the patient will present with a very typical and common disease or condition and present with atypical symptoms. Mm-hmm. Which then tells you that, say, in treating pain and injury, we can narrow things down to 25 injuries that cover, 80, 90% of all the problems we see. No matter how the patient presents, it's probably going to be one of these top 25 or 30 injuries or tissues or muscles or what have you, because those are statistically where the stresses are and where the stagnations occur. And then once you learn that, everything becomes so simple. You could do it in your sleep.
Well, it makes so much sense. We're sitting here having this conversation, and I'm thinking to myself, partly because I'm kind of a lazy guy. I've always been sort of an 80-20 guy, right? I'm looking for that 20% of something that's going to get me 80% of the result that I'm looking for.
Uh-huh.
And I always chalked it up to being lazy, but I'm listening to you speak about this, and I realize, but it's also true. I mean, it's so often 20% of the cases I'm sorry, 80% of the cases are probably going to cover 20% of the issues.
Yeah.
Right?
You're brilliant. You've got it figured out. Then you've just got to make sure you know what those 20 conditions or 20%.
Right. Know when the exception shows up.
Yeah.
What are some things that tip you off that there's an exception?
I'm not sure I can answer that question. I think I would have to hear that question within the context of a specific,
something specific.
Yeah.
That makes sense.
Yeah, I think that's a little bit that's asking a little too much of me. I don't think I can.
Yeah, no, that makes sense. That's so. And for me, this is the difference between theory and practice, because we can have these nice ideas, but really, it's the nitty gritty where the stuff comes together. And so, speaking of that, and you were talking about earlier about treating the lumbar back pain with the the usual sets of points. What about like the Jingwell points on the tendinomuscular channels? And what about things like the She-Clef points that are supposedly so famous for treating pain?
Uh-huh.
How do you see those playing in our modern acupuncture world these days?
I start with always considering bleeding a Jingwell point of the meridian or meridians involved. That's the first step that I think of, even if it's just going to clear off a level of stagnation in the tendinomuscle meridian on the more surface of the body. It's a start. And many patients will kind of go, oh, that feels better. How'd you do that? It doesn't get all the way down to maybe a tendon to bone junction. That might be too deep for the tendinomuscle meridian. But I very much like to start, if applicable and if indicated, bleeding one or more Jingwell points. I like to bleed with a lancet, and I like 10 drops of blood. So that's what I do with the Jingwell point. But yeah, it's the first thing that I think of after I've made this orthopedic or made this assessment and I know what tissue is involved. And then I have translated that tissue into the right meridian. So that, for instance, if it's a disc issue with pain going down the gallbladder channel, but the problem is in the spine, I'm not bleeding the gallbladder channel Jingwell point because that's not where the problem is. The problem is in the spine, So you do have to make sure with referred pain, you're not bleeding a Jingwell point of where the referred pain is. You want to bleed the Jingwell point where the stagnation and injury is. And so often it's the same, in the case of like shin splints, anterior shin splints, it's stomach 45. It's right along the stomach meridian. And, it's a no-brainer,
Mm-hmm.
But sometimes with referred pain, it can get a little more complex. So you have to make sure you do that right.
Imagine this. A patient walks into your clinic. They're carrying more than the pain in their body. There's a story there. A history woven with the stress of long days, the ache of things unsaid, and the quiet longing for something to shift. You listen, not just with your ears, but with your hands, your intuition, your heart. It's not just about needles or a formula. It's about connection. Understanding the threads that tie us together, mind, body, and spirit. That is where golden flower Chinese herbs comes in. Rooted in tradition And crafted with care, their formulas are more than herbs. They're a bridge between ancient wisdom and modern practice. Every bottle, a quiet partner in your work, helping you to meet your patients where they are. Because healing isn't just about treating symptoms. It's about creating trust, cultivating belonging, and helping someone feel truly seen. Golden Flower Chinese Herbs, your partner in practice and connection, where tradition meets care. You got to make sure you're on the right meridian. You're not
Absolutely.
not following some red herring.
Yeah, not where the pain is, but where
Go for where the problem is.
Yeah. And then then you mentioned the Shi clap points. Really, after bleeding the Jing Well point, I'll usually look to see if there's an empirical point of some other trick that might work. An empirical point, Ling Gu Da Bai or Yao Tong Shui, or any of those type of points. People who've studied with Master Dong's system, they have tons of options there. So I'll often try that before I start needling into the local area, because it gives you a chance for them to move it while the needle is in the empirical point or the opposite side or something. But once I've exhausted like the Shi clef point, the empirical points, and the Jing Well point, then it gets into local and adjacent. And that's where 70% of the time the treatment will evolve to include the local and adjacent points.
Right. So it sounds like you kind of work from the edges into the center.
Exactly. Yeah. And I learned that the hard way a number of times.
A number of times. I'm so glad I'm not alone.
Yeah. More than once, for sure. You got to get swatted on the head a few times. But it was during the pre-Olympic period in Los Angeles, 1984, and I had a British tennis player who had pain around Sanjiao 4, so on the dorsal surface of the hand, on the extensor tendon around Sanjiao 4. And he had had surgery to have a sheath release, and they tried to get out, all the fibrotic tissue from the problem. And I was so sure that there was still stagnation in that wrist. And I was threading needles along the tendons and trying all these tricks and, doing these strategic little cups and stuff. And little cups were not that easy to find back in 1983, And I treated him 4 or 5 times and nothing happened. And finally, I just got desperate. I went, I've got to fix this guy, So I thought, I remember upper-lower treatment. So there you have treat the wrist with the ankle. So I went to the opposite side ankle. Sanjiao 4 is the Yuan source point. So I went to gallbladder 40, Yuan source point. On the opposite side, I put a needle into gallbladder 40. He moved his wrist, and all the pain and all the decreased range, all the range of motion improved within 15 seconds. And it was just miraculous. And so he came back about 3 weeks later, said, that treatment worked wonderfully. It's just starting to come back. But he came in and talked to me before he kind of signed in. He said, I just want to make sure all you're going to do is needle that point down in the ankle. I don't want you to do any of this other stuff up in the wrist. I know what works, and that's all I want you to do. So it was so funny. The patient was just going to keep me from being so diligent that I was going to do bad treatment. He knew what good treatment was. And so I treated him maybe 3 times, and it fixed it. And it went completely against my belief system that kind of thing had local stagnation, and you can't get to it with the distal point. And, so that's why that you said outward to inward or from distal to local. That's why I kind of have this flow chart or this list that I can always look at. I have this in writing. It's in my book. And I have this progression of 10 techniques going from the Jing Well point to the local point. And I'm always looking at that just in case I think I'm smarter than the system. And so I'll look and I'll make sure that I at least consider the opposite side or upper lower or what have you. So I don't miss something thinking I'm going to go right to the local because I know that'll fix it. It usually does, but it doesn't
It
always.
doesn't always. Well, you know,
Yeah.
you bring up the thought about belief system, and I think we all are benefited and challenged by this, right? Because we've got ideas, and often the ideas work, or they work to some degree. But then there's the times where we've got a belief about something, we think it goes a certain way, but it really doesn't, and it takes being wrong and somehow okay enough with being wrong that we can set that belief aside and pivot or try something different or something I read in Witt's book or something, like this uh, thing you gave us from the Huang Di Neijing earlier about needling directly to where it needs to go. So often we have to switch, and it makes me think about here at the conference, you're presenting on a contrarian approach to treating low back pain. I kind of like contrarians for some reason. I don't know why. I'm curious to know, how do you go, and this gets into belief system, I think, but how do you go about developing a contrarian eye that helps you to get over beliefs or vision or ideas that just need to be gotten over or set down or viewed from a different way? How do you develop that contrarian eye?
Um, I think this gets back to one of your earlier questions about this battle we're fighting with the culture that we live in that sometimes is very detrimental to our mental, physical, and emotional and spiritual well-being. And so for me, I think what's most important is that the practitioner needs to have a discipline. And I personally think meditation is probably the most effective. For me, I'm a longtime meditator, and that's what meditation is you're just sitting in this moment, or you're sitting with the breath or what have you, and all you do is practice. Every time you start making the list of what you're going to do or what you're going to eat or who you forgot to call, you practice coming back to that focal point of the breath or what have you. And it's a very useful skill to help one in looking at the patient fresh every time. I'm looking at this as like this is the first time we've ever seen each other. And I'm going to look at this fresh to see if I can develop what I need to develop and assess and treat the way I need to treat to help this person. So I think the discipline is in the mind of the practitioner. And I think it's really essential that this be the case. I don't talk about it at all in my training programs. I don't tell people they should meditate. I never even hardly bring it up. But I think it's probably the most important thing. And so from that place of being able to have this fresh look at things, then you can start to develop a clinical experience that's effective. And in the case of the back, it bladder 23, bladder 25, bladder 40, bladder 60 didn't work. The Huatou Jiaji points didn't work. The dew points along the vertebral the center line didn't work. And so I had to kind of go, okay, if I'm honest with myself, this is not working very well. And thereby, then let's develop something else. And nobody else is telling me to do this. Nobody else. And that's what makes it contrarian, is that you have to jump into the river without anybody else there. You have to be willing to be hanging in the abyss, and it's the only way that you're ever going to be good is you've just got to hang in the abyss with terrifying loneliness and extraordinary terror of failing because you're doing something that's just not what they told you to do.
Yeah. Well, and it sounds too, sometimes it's recognizing the failure that we're already in the middle of.
Yeah, yeah.
And waking up to that and then finding something else. Well, Whit, I so appreciate your time, taking some time out here at the conference to speak with me and to share this with the listeners of Qiological. Any closing comments that you'd like to leave us with before we get back to the activities around here?
Whoa, closing comments. Well, certainly we're so pleased that so many people, so many practitioners want to look at this community that we've formed here of anatomical, orthopedic, and sports medicine practitioners. And they're all different. The orthopedic practitioners are different from the sports medicine acupuncturist in certain ways, but we all share a common basis of needing to know something about anatomy and movement, our assessment and treatment plans. And that is not articulated in Chinese medicine as the dictates that we get from what's translated into English or even what's still only in Chinese. But to me, it's so important because as we began this conversation of how different my patients are now from 1981, when I first started practice, imagine how different we all are from 1072, the year of the bronze statue, and the compendium of the bronze statue, where all the acupuncture points were presented in their entirety, except for extraordinary points that were added after that. So that's over 1,000 years, and I'm seeing change in 30 years.
Mm-hmm.
So, things are different, and we have to question. And we have to question Chinese medicine while we still love it, and we love the dictates of Chinese medicine. But we have to understand that it's not perfect and it needs to be added to. And what we're doing with an anatomical, orthopedic, and a sports approach is that we're just adding this incredible breadth to Chinese medicine and especially acupuncture. We're not creating a new acupuncture. We're just adding to the centuries old lineage that we've all been able to tap into and to be part of. And so I'm very appreciative that so many people would come to this conference because they too are looking for community. They've had their failures and felt alone. And sometimes the texts don't tell them what they need to know to fix something because it's a modern something that needs a different point of view. And so everybody is looking, and the community is completely open. There's nobody in charge. There's not a boss. There's not a guru. There's just a number of people that range from teachers to students, and eventually the students will be the teachers as all that goes forward. It's a beautiful system.
Well, there's a lot of lit up people here.
Yeah.
Whit, thank you so much, and I'll see you around the conference.
Good. Thank you, Michael, very much. You're doing wonderful work, and keep it up.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.